Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
The community is an integral part of any given scientific research because it is from them that solutions to health problems are established. Some of this research includes clinical trials. In an effort to improve the working relationship, the Ministry of Health is now partnering with supporting organizations with objectives including generating and sustaining community trust, protect and promote communities' rights and interests, and help studies optimize participation in the form of enrollment and retention of participants. The researchers, led by TASO and Makerere University, have developed national guidelines for community engagement in research.
We have, in terms of noteworthy achievements, developed the first set of guidelines for community engagement in clinical trials in Uganda, which are operational and effective. We have also developed a training curriculum.
Dr. Richard Kabanda, the Director of Health Promotion at the Ministry of Health, says some of the health problems in our communities can be prevented if there was a better working relationship.
We have had a lot of challenges previously in terms of programming, in terms of execution of activities at the community level, without having guidelines in place, without having policies in place. And of course, you know that implementation of health programs is basically based on research. So it's more of evidence-based practice. And the decisions that we take as the sector must be evidenced from undertakings at the community level in terms of research, either through clinical trials or randomized control trials.
We shall advance this work to create impact, to shape the direction and the presence of communities in research so that their interests, their voices, their representativeness and their agitations, any kind of queries that the communities are asking, all those questions, we shall be in position to respond to them. Half the work has been done. There is more work to be done.
Dr. Andrew Mijumbi Ojok says they have developed a tracking module for performance evaluation.
Can now register community advisory boards, track their performance, and their functionality is operational. The electronic community advisory board management information system.
In his view, Dr. Kabanda is optimistic that the guidelines will be implemented.
And also ensure that we move from theory to practice. Literally, we have been talking about community engagement theoretically in documentation and all that, and we think that this is now the time for us to go into the practical bit of it and ensure that whatever gets the downstream in terms of implementation is fully owned, is acceptable to communities, is culturally sensitive.
Walter Mwesije, NTV.
We are able to document approaches that are being used to onboard communities in clinical trials and research in Uganda. Secondly, we have developed fully fledged independent guidelines for the conduct of community engagement in clinical trials in Uganda, and we broaden this to other research settings. Third, we have a fully fledged training curriculum and operations manuals for the capacity of community advisory boards and other engagement structures. And fourth, we have managed to link the communities of practice, the community engagement practitioners, and the communities, the trial investigators, with the national research regulatory agencies, including UNCST, NDA, UNRO.
National Medical Stores, NMS, passionate about your life, with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in Uganda.